Hi guys, my name is Lindsay Connell and my EBP presentation is on CLABSI in the ICU. So CLABSIs are central line associated bloodstream infections. They are known as healthcare associated infections, and they've been linked to an increase in morbidity and mortality rates. And among other things, they're pretty costly to the hospital as well. These infections are one of the leading causes of death in the U.S. as well as around the world. So in the ICU, many patients receive central line catheters or CVCs to receive multiple drips, drugs, including vasoactive agents those types of things can be pretty caustic on the peripheral site, so they actually really need these central lines. And because these CVCs are inserted into the patients with they have direct access to the bloodstream, and the catheter itself being a foreign body, infections occur, relatively easily from bacteria originating on the skin. So the project was relevant to me because I work in the intensive care unit. I work with CVCs every shift. In my own unit, there's been about 3 CLABSIs to date, and this could ultimately mean 3 deaths in a year for something that's completely preventable. And it is preventable. So according, to the current literature, CLABSIs are preventable, despite all of our current treatment approaches, despite all our, prevention control. So the purpose of this presentation is to review EBP research to determine how effective unit prevention programs or these central line bundles are in the reduction in the infection rates of CLABSI. The research question here, so this was my main interest here. Do central line bundles prevent CLABSIs in the ICU population versus one single intervention? So PICO, the acronym, my population is the ICU. The intervention are the central line bundles. The comparison is the single intervention, and then O is for the outcome is a reduction in the infection rates of CLABSI. For the literature search to obtain, the current literature for this project, first a Google Scholar search was conducted for articles on CLABSI in the past 5 years. From there, the PA College's Open Athens site was utilized to retrieve the articles from larger databases such as Taylor and Francis or Elsevier. Subject headings that were utilized were related to the PICO question to be able to peruse these databases, and those included CLABSI in the ICU, prevention of CLABSI, CLABSI and unit programs, CLABSI and infection treatment. The literature was selected, had been published in the past 5 years. These were all peer-reviewed articles. Also, a lot of the focus was on quantitative studies, as they were a little more advantageous because your CLABSI numbers will have oftentimes a direct correlation to the intervention that was used. With the user-friendly nature of Open Athens and the ability to filter all the search results, locating quality references, it took time, but it didn't feel frustrating. So deciding on how articles are found by keywords in large databases is probably the most important. It's pretty key. So for the literature synthesis here, the research articles were split into 2 groups to answer the PICO questions. It was multiple modalities with the central line bundles versus one single intervention. So you've got Barinholtz 2016 study. They implemented a 10-year study. They looked at multiple modalities. They used a CL bundle, and they saw a 66% drop in CLABSI rates. Agapian 2019 study, they looked at 14 interventions. This was another central line bundle, but this was liver transplants in the ICU, and they found the result was 61.2% for annual reduction rates for CLABSI. Dick's 2016 study was the largest to date. It covers 1,000 U.S. adult ICUs. Actually, the Joint Commission used this study, which examined the actual bundle compliance. So 98% of these ICUs were using a bundle, but they wanted to understand why we were having such high rates. So they looked at, well, how compliant are they with all these interventions? So they saw a 33% reduction rate in the CLABSI when all 5 interventions of the bundle were actually utilized. So for these single interventions, I looked at Oren's 2015 study. They looked at silver-coated needleless connectors with the catheters, and versus just normal non-coated silver. They saw a 32% reduction in CLABSI rates. Bonenfant 2014 study looked at some NICU babies as with central lines, and they saw a decreased rate with chlorhexidine baths versus just soap and water baths. So for the overall practice recommendation, when implementing any one of these central line interventions, there was a decrease in CLABSI rates. So, and that was Dick's 2016 study. What he found, the group found that implementing more than 5 of these interventions had a greater and more significant decrease in the rate of infection. So, and then out of all these studies, if they had to pick one intervention, it was early catheter removal, which makes sense because the source is outside the body. They also found CVC dwell time of about 7 days is the reported number for the threshold for the lowest probability of a CLABSI. So my recommendations for this project was create a CLABSI unit program, and because I'm making, CLABSI is already an acronym, I made another acronym within an acronym, so I called it CUP. And the components to CUP, from the 3 studies of the 5 that are listed on here, the standardizing 5 interventions in the central line bundle, it was the gold standard. Also coordinating with infection control and nursing for the CLABSI program, and educating staff utilizing a CLABSI rounding card would be helpful as far as, taking out that catheter for, do we need to take this out early? Does it really need to be in here? So education, coordination with infection control, and standardizing these 5 interventions would be the focus in this program. So within the 3 studies, the bundle that the 5 interventions, the 5 elements, were hand hygiene prior to insertion, maximal barrier precautions, 3 chlorhexidine, skin antisepsis, 4 optimal site selection, which means like avoiding the femoral veins in adults, and then 5, doing that daily rounding, daily review of line necessity. So, and these 5 interventions would be on the back of that rounding card, just as a reminder for nurses to kind of just decrease that culture, that ICU culture, and prioritizing the safety and the seriousness of CLABSI infections. It was also ascertained in Dick's 2016 and Barinholtz 2016 study that multiple interventions, and not just one single interventions, had a better approach at improving quality. Dick's 2016 study also looked at infection and prevention control departments that had more resources, and found that with more infection preventionists it was about 100 beds, and then also coupled with the electronics surveillance systems, they were able to see lower CLABSI rates. So the greatest issue here is compliance and culture in the ICU. I feel that through the CLABSI program, we will be able to achieve a higher compliance rate just because we're focusing and prioritizing that and involving interdepartmental resources, such as infection control. So for the conclusion here, any one intervention results in lower rates of CLABSI is what they found, but 5 is the gold standard. Implementing of a central line bundle significantly decreased overall CLABSI rates. Regardless of the compliance of those 5 interventions, if at least one intervention was done well, you saw a reduction in these CLABSI rates. But the goal here is to improve it overall using, increasingly using all 5 interventions. And then decreasing that ICU safety culture, that culture shift is, there's a lot of lackadaisical habits in the ICU which may not uphold those 5 interventions. And obviously the last issue is the ICU compliance issue, which I just discussed about. That is the conclusion of my presentation. Here are the references, and thank you for your time.